Thank you, Matt. So I know you guys probably all want Matt to come to your home and do your home evaluation for safety and falls. And I'd like to offer his assistance. If you live on the eastern side of Western North Carolina, he can help you out in that area. So Matt works in home-based primary care with me, and if you have not come by the table out in this corner to see me, I can tell you more about home-based primary care. Alan mentioned that maybe I could enlighten you guys as to what non-institutional care means. So within the umbrella of geriatrics and extended care lives home-based primary care and non-institutional care, as well as many other things like medical foster home. If you met our social worker Jill, she talked about that. Non-institutional care are the services that are there that are to provide care for someone who is aging that is not in a facility. So it's not an institution. So that's home health services. That is non-skilled service, the homemaker home health aide. That's adult day care. That's bowel and bladder care. So if you're wondering what specific item or what specific services are available under non-institutional care, I have a flyer out there that lists all of them and the details associated with that. And then just a little plug for medical foster home, because I don't think anybody said that from this microphone yet today. Medical foster home is a program where veterans will live in a home with a caregiver who is trained to take care of them. So there's two opportunities for you guys today to talk to Jill about. One is maybe you want to take care of veterans in your home and you want to find out how you can be a caregiver who runs a medical foster home. She can answer those questions for you. Or maybe you or your loved one or you know a veteran who might be interested in that kind of setup, to live in somebody's home and get a caregiver who is in that actual home to care for you. Jill can help you with those questions as well. So this is, I apologize, we don't have a PowerPoint, but maybe we can do some creative measures to try to get you the PowerPoint, because I was not as skilled and as prepared as Matt with my notes. So my notes make me rely on my PowerPoint quite a bit. So I'm going to be flipping between pages here, so bear with me. So once again, I am a nurse practitioner. I'm not a pharmacist, but I have a lot of experience in home care. Before going back to nurse practitioner school, I was a home health nurse for 17 years. So I've been in a lot of homes around Western North Carolina, and I've done a lot of medication reconciliation, and I see a lot of stuff out there. One of the things I wish I would have brought with me today is a shoebox full of about 20 boxes of medications that are from 1982 all the way up to yesterday. I think the oldest, most expired medication I ever found was a nitroglycerin, and it was about 12 years old. So I want you to make sure that you're checking your expiration dates. But I did bring a couple of little hands-on things for you guys to see that I will reference as I go through here. So you're not going to see my slides, so I'm going to do some reading to you, and I'll try to not bore you to death. But evidence indicates that caregiving is complex, especially with medication regimens, relationship dynamics, healthcare practices, and lack of information training, and particularly with dementia care. And dementia is the fourth leading cause of lost years to disability in developing countries. There was a systematic review that stressed the empowering of caregivers to improve care, quality, and safety, offering best practice and support. So what that means is that good medication management by a caregiver can lead to improved health outcomes, reduced inpatient stays, and long-term placements. So that's what we're talking about this today. So you don't see this on your screen, but I have a few references even on here. So I did a good presentation academically, but you've got some learning outcomes. And some of the things that we're going to talk about today is how to organize your medications in the home, how to describe potential side effects for some commonly known drugs that you might see in the home. And that's where it's unfortunate you're not going to see the printed material or the stuff on the screen, but we will hopefully get that to you because I know you're not going to remember all the tongue twister medications I talk about today. To be able to identify over-the-counter medications that should be avoided in the older population. That one's huge. That's huge. Apply evidence-based strategies to optimize safety and adherence, and identify key medications requiring special handling and monitoring by the caregivers. So that brings me to the next slide, which talks about physical tasks and cognitive tasks that are required by caregivers to manage medications in the home. So, of course, you've got the prescription management. You've got the organization of the meds. And you need to make sure you got the right timing, the dose, and all those things. But then you've got the cognitive piece where it talks about, I need to know what the side effect of this medicine is. And they're on 30 medicines. How in the world am I going to remember all that? Monitoring those effects so that you can go back to the prescriber and say, my loved one's having a problem with this medicine, and then knowing how to communicate that with the provider. So the average, the average number of medications that community dwelling older adults are on. Anybody idea? I'm gonna take some tips from my previous. Anybody know how many? Shout it out. 15. Okay, that might be maybe if they're 80. Yes. What was another answer? 20. Okay. So the average number of, and you're right, thank you. The average number of community dwelling older adults are on 6.2 medications, but that increases as they get older and they have more comorbidities. What? I know, he said we're shot. And then institutionalization actually increases the number of prescribed medications. So we're talking about polypharmacy here. So this next slide talked about evidence-based strategies for safe medication management. And one of those is a medication list. And Dr. McGoy talked a little bit about having that bag handy. Well, I want you to have a medication list handy, and I want it to be up to date with the frequency and the dose of the medicines. Because if you happen to have to call 911 or EMS to have them come and see your caregiver, they're going to want to know what they're on. But when they see this list and it's up to date, it's a lot more useful than handing them a bag of your prescriptions from 1982 to today, right? So that's important. It's useful to your medical provider when you go to your appointments. And remember, if you're not a participant in home-based primary care and we can't see those on your kitchen table, that you want to take those medications with you to your appointments. It is also important to remember to get refills early. So if you get your medications through the VA, you want to allow for 7 to 10 working days, not including the weekends or holidays, to get your medications. And I had the number up here in case you need it. It's 2995835. And you want to make sure that you discard your expired medications. And we're going to talk about like how do you safely dispose of medications as well. The other thing is medication charts have been known to improve caregiver confidence and preparedness and improve adherence with taking medications. You might take a visual paper, put it on the refrigerator, and have a chart that maybe the veteran can see what they're supposed to take their medications for and that kind of thing. Alarms and apps, so you can use your phone, of course, and get some apps on here. 2 that I found were called Round Health and Care for Today. Those look like 2 that I might consider using if you are into the techie side of things. And then also other compliance aids are going to be pill box and pill cutters. So if you get your medications from the VA, I want you to know that you can ask for one of these, because more than likely they told you to take 7.5 milligrams, but told you to cut the 15 milligram itty bitty tablet in half. So this is your friend. The other thing that you can get from the VA is your pill box. So these are the pill boxes that we give out, and you can fill them for every day of the week, 4 times a day. So we're going to talk a little bit more about pill boxes in a second too. Other things that are available in the community might be blister packs. I know Sona offers that option for patients. But you want to make sure that you're doing like a structured dosing schedule. That will also improve your adherence to taking medications. And then if you have special, like you need to crush a medication or something like that, make sure that you talk to your pharmacist, because not all medications can be crushed. That is an important thing. You would hate to give somebody something that is a slow release and you crushed it. So you want to talk to your pharmacist about that. And making sure that you know that you have a pharmacist that is available to you inside your PAC care team. So if you have questions or you want a review of your medications to see what you could get taken off of, deprescribed, then that's one of the resources that you have to decrease the pill burden and potential for interactions. This is where the slides would have come in handy. So I'm going to tell you some tongue twisters. So if you get your medications from the VA, you know we only do generic. Nobody having a brand name around here or something that you can easily say, right? So we're not going to call it vitamin C. We're going to call it ascorbic acid. We're not going to call it iron. We're going to call it ferrous sulfate. And then to make it more complicated, no vitamin D for you. You only get ergocalciferol or cholecalciferol. Then if you want B12, we're going to call that cyancobalamin. And then if you want Tylenol, we're going to call that acetaminophen. So these realize that they are equivalent to one another. So they're very isosorbide. I had somebody the other day say, I'm on that medicine, it's like nitroglycerin. I'm like, isosorbide. Well, that would have been a lot easier to say MDOR. So all these medicines have two names. So just realize that the tongue twister names that are on the pill bottles may be equivalent to going out to Walmart and buying vitamin D. The other ones that I wanted to make sure that we are aware of names, because we're going to talk a little bit more about this in the second, is NSAIDs, non-steroidal anti-inflammatories, ibuprofen, naproxen, Aleve, and Advil. Essentially, the daily routine of those in the elderly population, that should not be happening. So we don't want to be taking those medications, at least long term. I hate to say an absolute, but I kind of cringe when I see somebody older than 65 taking an NSAID. Okay. Now, we're going to move on to talking about some more over-the-counter medications that I want you to make sure that you avoid. Another big one, Benadryl. Just don't take Benadryl. Increases your risk for falls, increases your risk for confusion, urinary retention, constipation. It can make you have a dry mouth. It is a bad one. And in that same similar thing, y'all don't know probably, Tylenol PM and Benadryl, they're like the same thing. So you don't want to take that either. If you're having trouble sleeping, talk to your medical provider and say, I'm having trouble sleeping, what should I take? Don't go out and treat that yourself with a Tylenol PM, because you literally could end up falling or having an adverse effect to that. Let's see. The other thing about, and you can see this is my soapbox with an NSAIDs. One of the reasons we don't want you taking NSAIDs, it can increase your blood pressure. If you have heart failure, it can worsen your heart failure. You don't want to end up in the hospital because you accidentally took the wrong medication that was over the counter. It can worsen your kidney function if you're on a long period of time. Increase your risk for bleeding. So it's a bad idea, and it's also can interact with a lot of medications. So you just want to be careful with that one. Let's see if there's anything else I wanted to, because I had a lot of stuff on this slide. And then hypnotic non-benzodiazepine medications, you want to avoid those because of delirium and falls. But I want you to be aware that there's a lot of food and drug interactions. So warfarin, not many people are on warfarin still anymore. They're on apixaban, Eliquis, those medications. But just be aware that warfarin really doesn't get along with many other medications. It's not friendly. So just got to be very careful with that one, and almost anything else that you put into your belly you want to talk about with your pharmacist. There are over-the-counter herbal remedies that will not do well with that, all the way down to primrose oil. Who even knew? If you're on diabetic agents, you can have a risk of hypoglycemia. Diuretics, furosemide, Bumex, Lasix, those medicines, if you don't take them properly or as prescribed, it can end up with kidney injury, or you can get electrolyte abnormalities that'll make your heart go out of whack. So you just really need to make sure that those are monitored closely by your provider. And then psychotropic medications. You know, we talked about some behaviors that you might have as you're taking care of a loved one, of a veteran. Make sure that you're watching the side effects for these medications. Sometimes psychotropic medications are given because they want to decrease behaviors. But be aware that we want to be on the lowest possible dose, because there are some significant side effects that could happen with that. And then here's my next soapbox, and I forgot my Narcan. It was in my other bag. But I carry my Narcan with me, and opioids. If by chance you have a medical provider who's prescribed you opioids, ask for some Narcan. You need to have that in your home, because you don't know. I'm not saying that somebody's going to intentionally overdose on these medications, but you don't know who's going to be accessing it. This is safety. You need to be prepared. Also with opioids, be aware that it will constipate you. I can guarantee that. So have a bowel program to go along with those medications if maybe you're having surgery and you were given some hydrocodone after surgery. So the risk of adverse drug reactions increases as the number of medications increase. So we want to make sure that we're going over and making sure you still need these medications. If something you no longer need, we need to deprescribe it. And then I'm just going to hit a couple of things that are meds that you've probably heard about that are herbals, because, you know, the herbs can cure anything. So St. John's wort, ginkgo biloba, garlic, ginseng, ginger, kava, evening primrose oil, and dong quai. I'm not sure what dong quai is. But all of those medications will likely interact with several medications that your loved one could be taking. And then just realizing you'll be able to, if we can get you these PowerPoints, you'll be able to see some other things that I put specifically on here. Levothyroxine, need to be taken on an empty stomach, okay? That is levothyroxine, is Synthroid. That's a thyroid medicine. Proton pump inhibitors like Nexium or Protonix, omeprazole, those also need to be taken on an empty stomach. Statins, we usually have you take those at bedtime because that's the best time for them to work. So those would be medications like Lipitor or Crestor or Zocor. And then we did touch a little bit about warfarin. It is a blood thinner, Coumadin, also known as Coumadin, or some of my mountain patients have said that's rat poison. That's the one I'm talking about. You want to make sure that you keep consistent with the salads 2 times a week and your greens, consistent, because that could mess up your levels. Then we're going to talk about medication storage. So if you live with somebody who, or you're caregiving with somebody who has dementia, or you have children in the home, you want to make sure you keep these medications locked up. I like it when I go to a patient's house and they have them in a tackle box or a toolbox. That's really cool. And then they can put a lock on it, or they keep it up in a high cabinet in a basket to where somebody can't get to it easily. You want to store them in a cool, dry place, out of the reach of children, like I mentioned. And the other thing, don't mix your medications. So if you have a new bottle of your Lipitor and an old bottle of your Lipitor, resist the temptation to put them together. Keep them separate. A lot of times the manufacturer of these medications will change it from a green pill to a purple pill. And then you're putting them all in the same, and that's just not good. That's one reason it's not good. The other reason is because they expire at different rates. Avoid areas of excessive heat, moisture, light. And so remember, when you have your pill box, you want to not store it somewhere where it might be in the bathroom and it's going to be exposed to a lot of humidity. Then the next thing we want to talk about is medication disposal. So it's, how many people here have, I'm done with this. I'm going to dump it down the toilet. Let's not do that. So we don't want you to throw it in the trash, flush it down the toilet, rinse it down the sink, or give it to a family member. What we want you to do is to put it with something that somebody wouldn't want, like cat litter or coffee grounds. Those are the two that I usually use. Mix the drugs with an undesirable substance, and then put it in a sealed container, Ziploc bag, margarine container, and then put it in the trash. So that is a safe way to get rid of medications. And then just realize that at the VA, we do have envelopes where you can dispose of medications. So those are available at your pharmacy. You just have to ask for them. And you want to remove all your personal information from the packing before discarding it. And then finally, the last thing I want to talk about, and I don't know if I went over, so I'm sorry, Dr. Tugman, if I got into your time. I have a lot of stuff up here, so I wasn't able to look at the time. But you want to make sure that you're adjusting for medications or talking to your provider, adjust medications based upon changes in cognition, mobility, and your health status. So that means that you need to be reevaluating if you're on the right dose of the medicine based upon your kidney function, or if you still need the medicine with the progression of the disease. And then you want to monitor, of course, for adverse drug reactions, especially for those high-risk meds, like I said, and deprescribe when it's no longer important. So one of the things that we've started doing in home-based primary care is we're now designated, according to the IHI, as age-friendly. So what we do is we talk to our veterans about what matters most to them. And it may not matter most to them to be taking the diuretic anymore. It may be that they want to enjoy their last days and have a quality of life and not go to the bathroom every 30 minutes. I mean, I'm picking something out of there, but there's many scenarios that we can give. So we want to be considering risk-benefit of the medications, whether or not they're still necessary, and whether or not they align with the goals of care that you all have. And medication monitoring requires ongoing assessment of your renal function, your cognitive function, and your comorbidities. So know that your team is there and available to talk about those things. It's not once you're prescribed it, you're always on it. So does anybody have any questions? I probably left something out, but...
I just want to say that I know in Hendersonville, you can take your meds, your unused meds, to the sheriff's department, but they want you to take them in their container, and then you empty them in one of their offices and then put it in the thing.
Okay, good. Good to know. Good to know. I know they'll do that at many of the pharmacies. They'll collect the medications too, occasionally.
You mentioned 2 apps on that you can put on your phone for list your drugs. Can
Yes.
you
Yeah. So one is called Round, as in circular, Round Health. And the other app is called Care, the number 4, Today.
I want to, excuse me, I want to mention I have an iPhone, and when I put my medications listed and the time of day I take them, I automatically get a reminder tune.
I love that.
And so you don't have to necessarily load an extra app for that.
I love that.
The Apple phone will also tell you if there are drug interactions.
So I hear the Apple phone will also tell you if there's drug interactions if you have an Apple phone and you're able to use that.
Melissa.
Yes.
You know, obviously a lot of us are on this smorgasbord of meds,
Mm-hmm.
and a lot of meds, and the meds are interacting with each other
Mm-hmm.
and are interacting with us and affecting us. So what I found helpful is the pharmacist. The
Yes.
pharmacist seems to know more about the meds than the prescribing doctor,
Yes.
right? And when doses change, you literally can consult with
You
the
can.
pharmacist regarding, is there an issue regarding the increased dosage?
Right.
So this is like an ongoing, but at Charles George, they're very user-friendly, the pharmacists. And
Mhm.
like I said, they know a lot about the meds. So I found them very helpful.
Yeah.
And the other thing, there were times where they gave you this little bitty pill, and they told you to cut the little bitty pill. And you cut the little bitty pill, and you had little fragments left,
Yeah.
literally. And then you had to be aggressive with the pharmacist or the doctor that that's no longer acceptable. And then they would change it, but
Yeah,
you-
that can be changed. So, yeah, go ahead.
So you could actually ask your doctor, you can say, listen, my fingertips are just not working to cut these pills in half. Can you please write on the prescription to dispense a full tablet?
Yes.
And that's one thing.
The VA had a program, and I don't know if it's still going on, but they looked at your medications and they looked at the DNA
Uh-huh.
of
I
how
was gonna
they're
talk about
broken
this.
down. Yes. Can you talk a little bit more about that? Are you still doing that?
Yes, phaser. It's called the phaser. And so if you want to have that done, all you have to do is tell your primary care provider that you would like to have the phaser, PHASER, testing done. And what it does is it looks to see how your body reacts to certain medications. It's not all medications, but for example, one of the ones that they do check is antidepressants. So some people will metabolize an antidepressant different than another type of antidepressant, and it can help us target which would be the better medication to prescribe. So, yeah, the phaser program is what that's called. Yeah. Any other questions? You good? Okay. Thank you, guys.